43% of children and young people said that they wanted to be more involved in their care than they currently are. We also know that when children and young people go home from hospital, they want a bit more information. What can we do to actually fix that? We know that children who've got learning disabilities, children who have got mental health needs, and children who are physically disabled all told us that their care wasn't as good as it could have been. We also know that children from black and minority ethnic families told us that they were having poorer experiences. So there's a bit of a call to action here. When we encourage children and young people and their families to speak up, it can save lives. That's why this stuff is really, really important. We've had 3 events. We've been able to reach out to over 500 healthcare professionals. Hearing and capturing the voices and experiences of children and young people is the right thing to do. We're not doing it as much as we could be, and we need to be doing it more.
I think it's really important as a young person to give feedback on the services that the NHS provides.
Today I am presenting our new campaign, Dear NHS. It's a letter to the NHS describing what we think should be done to improve the healthcare service for young people.
I think the NHS are doing a good job already, and I think they could do better by creating a hospital passport for young people and adults.
If I can improve a service so more people don't have to go do the same thing I did, makes me feel a lot better about myself.
Kate Martin came to us. She asked us to talk about our experiences with GPs and how we could make a model to make those services better. So we sat down and we had a huge piece of paper on the floor and we were writing everything. And then her company went away from that and built this model up from exactly what we'd said.
I also hope that people will pitch some ideas and take them away and implement them.
Think about using words the young person understands.
Think about listening and being kind.
Think about using metaphors. So for example, a commissioner is kind of like when you're going shopping, you put all your essentials in your shopping trolley and then you might pick up a chocolate bar on the way out, kind of thing.
Think about children and young people and families with autism, whoever you meet in your healthcare experience, less is more. Now and next, or then and this. Just think, less is more.
So what do you think is the most important thing that health professionals need to get?
Pictures, really clear pictures.
Yeah.
And thin builds.
And do you think that would be good for lots of people?
Yeah,
because you know, when you walk down the road, you know where it says stop or go ahead, don't you?
Yeah.
But there's not a great big essay, is there?
No.
Not sort of big words. You get on a plane, and it has a card, doesn't it, with just pictures on it. So why do some people not want to have pictures with everything?
Don't know.
Somebody who's got a learning disability has a learning disability. Generally they don't have an emotional disability. They still pick up on your mood, your emotion, any disapproval, anything like that. Just be open, be neutral, be friendly.
Be honest, be interested, ask them what they want, ask them why they're there. Share a decision with them and let them take control of their own healthcare.
And of course, as well as these 3 events around the country, we've also got Twitter going absolutely bananas using the hashtag CYPExp. So we've had the conferences, but we've also had a virtual conference going on over the 2 weeks as well.